My name is Brian Morgan, and I'm the Vice President of Health IT Strategy for GovCIO. I'm currently supporting the U.S. Department of Veterans Affairs as the lead strategist for the Health Technology Office under the Health PMO contract. I've been in Health IT for nearly 25 years, 8 of which were as a federal employee, and I've been working with federal agencies such as VA and DHA, primarily focusing on VA systems and processes. An EHR, in the most basic terms, is an electronic version of a patient's medical record. It includes information on the patient's health issues, problems, prescriptions, provider notes, lab results, medical imaging, and anything else that could be relevant to a care provider in diagnosing and providing treatment to a person. In the context of both VA and DoD, the ultimate goal of an EHR is to provide seamless care throughout the lifetime of a service member, similar to the original intent of the VELAR initiative that I was previously involved in. Both VA and DoD perform in-depth medical research and establish links between many different medical conditions and events related to military service. Now that medical records and associated service information are available electronically, researchers can leverage artificial intelligence and big data analysis tools find commonalities between service locations and medical conditions much faster than ever before. High-risk groups can then be proactively monitored and treated for early-stage medical conditions rather than waiting for more severe indicators to occur. Two of the biggest challenges with EHRs are interoperability and data sharing, whether it be the exchange of information between private sector providers or the passing of data between legacy systems and new systems. While one might think that replacing an old system with a new one would be straightforward, standing up a new system, migrating the data, testing that it works, etc., and that it's done, that's not reality. In complex environments like VA and DoD, there are hundreds of interconnected medical and non-medical systems that rely on health data to function appropriately. Oftentimes, these non-health systems are not considered to be a priority and don't function appropriately when their data needs are not being properly considered. Like they said in a cartoon when I was growing up, knowing is half the battle. Knowing which systems use health data, what data is being used, how they use it, and examining the enterprise architecture and validating organizational data management strategies, along with their associated data and system architecture. Those are critical components to ensuring systems continue to function correctly. Once you have a handle on existing systems and how business value is attained from those systems, look at where you want to go as an organization. Oftentimes, an EHR implementations are more than just a technology change. They include redesigning business processes for efficiency, assessing the criticality of legacy systems and their business function, decommissioning older systems, and planning for future needs. EHR implementations are challenging. They almost always run into unexpected hiccups, and having a plan to not only proactively address those challenges, but also how to deal with unanticipated challenges is also important. Spending the time to fully assess the environment is critical to a successful implementation while balancing the needs of the business customers and the patients they serve.